Hi everyone. I welcome you all for this live session. I am Dr. Bhavyashree. I am an interventional radiologist working in Gleneagles Hospital at Richmond Road. Today we are talking on breast, and the topic is breast cancer awareness and importance of early detection and emerging non-surgical treatment options for breast lesions. Firstly, breast cancer is the most common cancer affecting women in India and globally. Almost on an yearly basis, about 2 lakh women get diagnosed with breast cancer in India alone every year. And fortunately, we have very good screening modalities like mammograms to detect this breast cancer at the earliest stage and even in the precancerous stages. I'll come to that in a bit. Before that, what we see is even in these days, most of the women, at least some women, they present to us in very late stages, like probably with very large fungating masses, which has spread to rest of the body. And when you try to interact with them and try to find out the reason for such delayed presentation, most of the people come up with two things. One is the lack of awareness, and second thing is the fear. Lack of awareness. Most of them would have noticed that there is a lump in their breast, but they say that doctor, it was not causing any pain. That's why I did not go to any doctor. So definitely there is lack of awareness when it comes to when it's about the breast cancer symptoms. Any lump in the breast which is persisting beyond 2 weeks needs evaluation. It needs to be examined by a breast specialist. Having said that, not all breast cancers are cancers. Majority, nearly 90% of them turns out to be benign, and only 10% or less than 10% of the breast lumps turns out to be malignancy. So please don't hesitate to get it evaluated whenever you feel a lump. And some of the signs and symptoms of breast cancer. So, lump in the breast, which is mostly painless. Sometimes it can be painful also, and it is usually firm to hard in consistency. It's usually fixed to one point in the breast, and that means it will usually be not moving within the breast, and it can be associated with skin changes like discoloration, reddish discoloration, skin thickening, puckering, or sometimes ulceration. It can be associated with changes in the nipple, like nipple retraction, wherein your nipple is pulled inwards, and there can be bloody discharge in the nipple as well. So, these are some of the signs and symptoms of breast cancer. And the second reason for the delayed presentation is the fear. Generally, they would know somebody in their close circle, either a family member or their friend, who got diagnosed with breast cancer and who had to undergo a mutilating mastectomy, the removal of the breast. The complete removal of the breast, which is called mastectomy, is usually socially embarrassing to many women. And sometimes they would know somebody who was diagnosed with breast cancer and who lost their life. And they assume that even they would have the same fate once they get diagnosed. So that's why they usually don't turn up and get it evaluated. No. Breast cancer treatments cannot be generalized, meaning if somebody has had a mastectomy, you need not have mastectomy. If somebody has lost their life, you need not lose your life for breast cancer, because the treatment for breast cancer are very specific. They're individualized based on your stage, your tumor subtype, molecular subtype of the tumors, the tumor biology, and the grades of the tumor. If we are able to detect the breast cancer in the early stages, like say for example stage 0 and stage 1, we have very good prognosis. So mostly we aim to cure these types of tumors, and your 5-year survival rate almost exceeds 95%. Here we typically offer breast conservative surgeries like a lumpectomy, where only the nodule will be removed and rest of the breast will be spared. And this will be coupled, depending on the tumor biology, this will be coupled with either the hormone therapy or the targeted therapy. And if the tumor is of high grade, then we might have to consider chemotherapy or radiotherapy. In case of stage 2 and 3, so this means that the tumor is locally growing or it has spread to the surrounding lymph nodes. outcome may not be as good as stage 1, but it is still better than stage 4. And here 5-year survival is nearly 60 to 70%. And here we typically start with chemotherapy, and again we start with tumor specific treatments like targeted therapy and immunotherapy or hormone therapy, and try to downstage the tumor, try to shrink and downstage the tumor, and then see what suits best for you. Whether we can offer breast conservative surgery or we can offer mastectomy. Even if it is mastectomy, you need not worry, because most of the times mastectomy can be coupled with very good reconstructive surgery with very good cosmetic outcome. Stage 4. Stage 4 is when the tumor has spread from the breast to rest of the organs like your liver or lung or bone or brain. Definitely, compared to stage 1, outcomes may not be good, but still, with the advances what we have in the recent age, we still try to prolong the life of patients who present to us with stage 4. We have very good chemo options, we have immuno options, especially in patients who are positive with PDL1 receptor. We offer immunotherapy. We try to downstage the tumor and see if we can offer the surgery, and also if the metastatic lesions are less in number, we call it as oligometastasis. Suppose if there are only 2 or 3 metastatic lesions in the liver or in the lung, we try to offer organ specific treatments for the metastasis as well. Suppose if there are 2 or 3 lesions in the liver, we offer treatments like ablation or resection or segmentectomy. Some options are still available, and similar in case of the lungs, we can offer segmentectomy where a portion of the lung can be removed, or we have options like radiofrequency ablation or cryotherapy where we can completely destroy the metastatic nodule. So even in stage 4 we still have the options because of the advances in the medical science, and we can still try to control and prevent the further growth and give you a good survival benefit. So no matter what is the stage, please reach out to your medical professional, reach out to any medical professional, and try to get it sorted. Now, coming to the early detection, how can we detect this early? How can we detect these cancers at an early stage? For that, we have 3 things. One is self breast examination, second is clinical breast examination, and third is screening mammograms. Every woman out there should be breast aware, meaning she should know how her breast feels and how her breast looks. For that, she has to do a breast examination by herself, and this has to be done preferably on the monthly basis, or else at least on an alternate monthly basis. Ideal time to do the self breast examination, if you're a woman who is having periods, then you probably do it on the 5th or the 7th day after you finish your periods. If you're a postmenopausal, if you've stopped having periods, then you can choose any month in the calendar, like 1st of every month or 15th, whatever is convenient to you, and make sure that you do your breast examination every month. And what is the correct method to do the breast examination? Firstly, you will have to stand in front of a mirror. No shame should be there. Stand in front of the mirror. Keep your hands behind your hips, and then just look at your breast. Look for any changes in the skin. Look for any changes in the contour. See if there is any puckering or dimpling happening. Raise your hands. See if both the nipples are raising at an equal level. If one is raising above another at a higher level, that is abnormal. And third thing, you will have to palpate your breast. So what is the right technique to palpate? You will have to do it while you are taking a shower. And suppose if this is your breast, you will have to palpate with the pulp of your 3 fingers. So make the small circular movements, press it against your chest wall, and try to cover your entire breast like this in the small circular movements, and try to feel for any lump. And never ever try to hold your breast like this and try to palpate, because invariably you will find a lump which is your breast, which is your breast gland, and you will be simply worrying, thinking that there is a lump or a nodule in the breast. So this is the correct method of doing a self-breast examination. Any lump found, any changes in the skin, any changes in the nipple, you need to visit a medical professional for clinical breast examination. They will assess if you need further evaluation in terms of imaging like an X-ray or an ultrasound or an MRI. Third thing is mammogram, screening mammogram, very, very important, because all the women out there are at a 15% risk of developing breast cancer in their lifetime. So all women starting at age 40 need to start their screening mammogram, and they have to do it every year up until 65 or 70 years. The importance of screening mammogram, we can detect the breast cancer at the earliest stage and even sometimes in the pre-malignant stages. There are pre-malignant conditions like ductal carcinoma in situ, where the cancer is only confined to the cells within the duct and it has not gone out of the duct. So even those changes can be picked up in the mammogram. And there are conditions like atypical ductal hyperplasia, and then radial scar or complex sclerosing lesions. All these conditions, they will increase the risk 4 to 5 times of developing breast cancers. So even these lesions can be picked up. So if at all, if we detect at this stage, this is the pre-malignant stage, or high risk lesions, then we can have a very, very good outcome. And people who are at increased risk, suppose if you have any family member who is affected with breast cancer, or if you have a certain gene mutations like BRCA1 and BRCA2, or if you have had radiation to your chest between 10 to 30 years of your age, then you are at an increased risk. Then you will need an enhanced screening protocol to detect for the early detection of the tumors. So in those case, probably we would recommend you to start off your screening through an MRI breast as early as 25 or 30 years. And then once you reach 40 years, probably you can start off your screening mammograms. So that is about the early detection. And now coming to the non-surgical treatment options. As I told you, 90% of the breast lumps turn out to be benign conditions like fibroadenoma or complex cyst or fibrocystic disease. Only 10% turns out to be malignant disease. Even if it is benign, if it is growing in size, or if it is bothering you in any way, like if it is causing pain or discomfort, we recommend it to be removed. Surgery is not the only options. We have non-surgical, minimally invasive treatment options with like vacuum assisted or microwave ablation or radiofrequency ablation or cryotherapy. So all these procedures are needle-based treatments where we take a small needle into the tumor and try to clear the lesion or the tumor. In vacuum assisted excision, small needle goes and we cut the tumor section by section and completely extract the nodule. And in microwave and radiofrequency ablation, we place the needle in the tumor, we generate radiofrequency energy or microwave energy, and we convert it into the heat and we try to destroy the tumor. And once the tumor is destroyed and becomes dead, it will be cleared through your body's immune system. And same happens in the cryotherapy. Instead of heat, we try to generate extremes of cold. We place the needle, we generate extremes of cold, and then we try to destroy the tumor, make it inactive and dead, and that will be cleared by the body's immune response. And all these are minimal invasive. They can be done on the daycare basis. The recovery is very, very fast, and there won't be any scar on your breast, which is like the main worrying point when it comes to surgery. And the recovery is very, very fast. And cryotherapy also works for stage 0 and stage 1 tumor, very selected early stage tumors. Cryotherapy is cryotherapy works well there as well, and trials are underway. And probably once the results are out, we can de-escalate from breast conservative surgery to non-invasive surgery, even in cases of malignant lesions. So that is about the breast cancer awareness, the symptoms, the early detection, what you have to do, and the non-surgical treatment options available. So if any doubts, I'll be happy to clarify those. So as of now, there are no questions. So please share the information. If any doubts, let us know. We will be happy to clarify. Thank you.